my first question is to you. Who is at risk for cervical cancer and how common is this HPV in our country?
Thank you, Dr. Sandhya. So, Human Papilloma Virus, or HPV in short, is a very common sexually transmitted infection. And as you can see from the cartoon on your left, at least half of all sexually active women are infected by HPV in their lifetime. And in India, the number of women who have HPV varies from 6 to 7%. Now, the virus is spread through intimate skin-to-skin contact, like what happens while having vaginal, anal, or oral sex with an infected person. And just to mention here that based on their propensity to cause cancer, human papilloma viruses are divided into two major categories: a high risk high risk type and a low risk type. So high risk types of HPV are the ones which cause cancer, various types of cancer, and low risk types, they don't cause cancer, but they cause some other non-cancerous infections or diseases. Now, the incubation period varies from 2 months to 10 years, based on primarily based on the type of infection, that is type of HPV, and also on other contributing cofactors.
And in what age groups is this very common, Dr. Jayshree?
Yeah, so basically HPV, you can see as per the graph here that you have two major peaks. One is seen when a woman initiates her sexual activity. So you see it in the late teens and early 20s. And you also see a second peak, which is in the 5th and 6th decade of life.
Yeah, so that is quite interesting and important for us, I think, because, we rarely think of these kind of infections in the under 25 age group, especially in our country. But the scenario is changing now, so we need to be aware of the problems at this age group. And interestingly, I suppose it is very common after the age of 65. Why do you think that could be?
So there are some reasons. Actually, Dr. Jyoti would be in a better position to answer that, but vaginal atrophy is one of the reasons. You can contract the infection more easily.